Bob, could I make a comment? You're pointing out that each patient is different and requires different care. One of the great advances would be to be able to identify by their genetic differences those who are likely to have trouble and those who are not. And of course, much of the recent work using SNPs and polymorphisms to detect those at higher risk. Another point I couldn't help making is that many of the devices that you've built on and applied were developed by NASA for the space programs, for the Mercury and the Apollo, when they had to have constant monitoring of cardiovascular phenomenon and others going when they're going around the world, and then later when they went to the moon. And that was the basis of the ICUs and the monitoring devices, and also the invention of the MEMS, microelectromechanical systems, was done on contract to place a MEMS on a rat's heart valve for measurements in space, and then for the chromatograph they put on Mars. Some of the study centers you used were in places that have affect government medicine, socialized medicine. And in those systems, at least I think in theory, the doctors actually get paid more if the patient doesn't get sick. Well, were you able to make any measurements?
Unfortunately not. Mm-hmm. Even in the government systems, as you say, there are very few who actually get paid more in the United States if the patient stays well. Very few. It's in our center's 29, there was only one. So it's hard to make an analysis on that one center. And they only put in 6 patients, so I couldn't do a separate analysis.
Presumably that would make a difference, wouldn't it?
Maybe.
All right. One last question, yes?
I have two comments. Chezi Barnold, Hebrew University of Jerusalem. One is related to actually all the political aspect, whatever social, what you said. I think it's more money than everything else. I think it's a problem that I know for a very long time, developing a drug delivery system that actually you may lose much less drugs, that, for example, the companies really shut the doors. They don't want to hear about it, you know. So I think these problems is something that really may destroy the medicine from being much more beneficial to people. And I think we as scientists, MDs, and social workers have to find solution to this. The second is really something related to the telemedicine that you said. We have an experiment ongoing in Israel, in Jerusalem, in our hospital, that is used by orthopedics department, in which patients that agree are attached to a GPS. And this changed the world of the orthopedics, because once the patient released home, they have a continuous monitoring on the state of the patient, how much you walk, how fast you walk, where you go. After every surgery, you have now an objective information about the status of the patient, because what happened many times, patients come to the physician, depend on their nature, I don't know what. They said, I felt terrible, I couldn't do anything, I just lie in bed. But then the physician looked at the record and said, guy, here you walk 2 kilometers this day, 4 kilometers the other way, so don't tell me story. Or the opposite, people that are always optimistic and for some reason they say, we feel excellent, but the physician now saw the guy, actually the physician or the nurse, it's a very similar system to yours, can call him and say, you have to walk now 3 times a day, that and that, and they can see how many times he went to the bathroom, everything. So I think it really, the people like it. It's a software that developed in our university and now started actually interesting from geography department, where tourist offices in different countries want to see how tourists are doing. And later it was transferred into hospitals, and now it transferred to many other things. I think it's a very, very powerful technique. The device is very cheap. A GPS also has a phone that the physician or the nurse actually see when the battery are running out, they call the patient and say, you have to load your batteries and things like that. So system work perfect. And I think it really will change the world of medicine.
We're trying. My wife makes me wear this so she always knows where I am. My little GPS. Hi, Tess. That's my wife in the back.
Thank you very much, Dr. Bourge.